I'm finding it somewhere. I'm finding it very good that people are actually waking up towards the mental health, towards the importance of mental health. Because and only positive thing which this pandemic did was, make people realize more about the mental issues, maybe which was very much neglected earlier. So thank you for having me today, and thank you for giving me this platform to share something about the mental health. Mental health, yes. What is the mental health? Mental health is something which is very bad. Maybe it is the taboo word. When I started my journey in BSc, when I was doing in my graduation days, nobody knew about the mental health. Nobody. It was in starting of 20s and nobody knew what is the mental health, what is psychology, karna kya hai psychology padhne ke baad, no idea to the people, because mental health was always taken granted. From since childhood we have been told that you have to be strong, but what is strong? Yeah, complaint से strong होते हैं वो हमें पता है, but mentally कैसे strong होते हैं ये कोई नहीं जानता. So what exactly we have to do? How we have to tackle all this stuff? Always we see parents. I'm a clinical psychologist by profession. My first love is clinical psychology. But these days I'm very much into academics, so I have lowered it, the burden, but still I'm into it. So whenever I saw parents, the parents are always pushing the children to do this, that, and everything, but somewhere they don't make the children learn how to deal with the anxiety, how to deal with the failures, maybe how to deal with the heartbreaks, maybe, and lot many things. When we see the society has come here, this function where the social support is lacking, people, the families are becoming much individualistic, the people are becoming more, self-centered. So here, the learning of the family and that the knowledge of not to how to deal with the anxiety issues, somewhere it is a very little combination. We don't know what to do when we saw failures, because every time we have been asked from our parents to to be successful, but what exactly successful mean, we don't know. Something that when the Sushant Singh Rajput issue was on the peak, it is still in the peak, but when I was earlier, I saw one of his interview where he said, when I become a TV actor, then I wanted to be in the cinema, then I wanted to do something else, then I want to do something else, and then the happiness becomes the small ladder of things where I was feeling like, now I have gained this, now what next? Now when you feel happy or successful, the feeling is there for some moments, maybe for some days, but after that again you are there like, मैंने तो सोचा था मुझे वो चीज मिलके बहुत खुशी होगी, but now what? अब क्या करना है इसके बाद? So this is something, this is a continuous process. Okay, I'm sharing.
Ma'am, you got mute.
Yeah, I got mute. I'm sharing my screen. The topic which I selected to talk is depression. It is a very, very relevant topic, and I try to explain it in a very layman term. Let me see. Can you see it? Can you see the presentation?
Yes, ma'am.
Okay. I have taken depression because I get very irritated when people say that I'm feeling depressed these days. Last night my friend did it called and it is making me depressed. When people start using the psychological disorders as adjectives, it makes me irritated, because psychological disorders, the name of psychological disorders are not adjectives. They're very something which is serious. So I really wanted to talk about depression also, because we say depression as a common cold of psychiatry. Common cold means the viral infection, or not. It's so common, like common cold. That is why depression is known as the common cold of psychiatry. What is depression? See, this is a normal mood lowering. This you can see by this flow chart. What is the mood? Mood comes from the emotional state. Emotional state means when when you have your favorite ice cream, you are feeling good. And when somebody আজকে মা বকে দিল নাকি ম্যাম বকে দিয়েছে নাকি ভালো করে কাজ করতে পারলাম না এই জন্য মনটা খারাপ লাগছে, ওটা হচ্ছে একটা মানে মনটা খারাপ লাগলো, that is the lowering of normal mood. But ওটা যে খারাপ লাগছে, it can bounce back, you know, after some time, or after maybe after 2-3 days you will back to your normal self. When you cannot bounce back to your normal mood state, it is the abnormal mood lowering. And abnormal mood lowering, if it is with the loss of function, then it is depression. Depression, you know, is pervasive. Depression is persistent, and it has range of symptoms. When we say persistent, it means it cannot happen that, you know, in the morning I was having all the symptoms, in the evening I'm not having any of it. It is not like that. It has to be persistent. And to clinically diagnose a person with depression, it has to be for minimum 2 weeks. These are the range of symptoms: the negative views, feeling of worthlessness, incapacity, guilt, sleep disturbances, loss of energy, and impaired concentration. These are some very common, you know, the symptoms. But you will say that we all are facing this. मुझे भी negative views होते हैं. I also feel worthlessness. I also have sleep disturbances. But remember what I told you earlier in the earlier slide. It has to be persistent. It has to be, you know, persistent, pervasive, to make you or to make anybody to have the depression as the psychological disorder. Then impaired work ability, it disturbs your work ability, it disturbs your social functioning, it causes psychomotor retardation, it causes pessimism. You know, we have lost lot of thoughts about society. When the people are in depression, we feel that, you know, the person is having lot of societal thoughts. Societal thoughts means that, you know, the life is so worthlessness, it's so bad, there is no meaning of living, it's better I die. If these thoughts, societal thoughts, when they are persistent, again they are most of time they are in our mind, and the person is actually thinking about taking his own life, it means there is something serious. Then there is who are vulnerable, what make people, you know, develop depression. There are losses which can turn people to have depression. The losses could be financial losses, the losses could be emotional losses, the losses could be anything. Then the stressful life event. Parents going through some kind of marital thought can lead to depression in the children. Separation from the parent can cause depression in the children. Then the lack of social support, physical illness, familiar factors, genetical factors, these all, you know, they are the vulnerability. When I say lack of social support, what does it mean? These days when we are in under pandemic, lot of cases are increasing for, you know, for depression. Why? Because somewhere we are lacking that social support we used to have. How we are lacking? For example, especially for you guys, for the college student, কলেজে পড়ে আড্ডা মারা, কথা বলা, খেলা করে যাওয়া, মানে so many things, the hobby class and everything, which is not happening these days. We as a human being, we are the social animals. We need social support. This is beyond doubt. We are, and nowadays we are, you know, we are connected with the people, but through the technology. We had the gadgets, but we don't have the people. So we need that physical connection with the people. This lack of physical connection is the, you know, is the main cause why we are feeling so much depressed these days, why the sadness is coming inside us, because we are lacking our social support. Then what is the genetical factor? Genetical factor is something, you know, when somebody in your family, somebody with whom you share your genetical material, like your parents, like your grandparents, like your first degree you know, relatives. First degree means like your pishi, your mama, somebody with close blood line, with whom you share your bloodline. If these people have some kind of history of depression or any psychological disorder, then you are vulnerable to have, you are prone to have, to develop depression. Then we in mental health profession we follow two diagnostic criteria. One is DSM, another one is ICD. DSM means Diagnostics Statistical Manual, because it's coming from American Psychiatric Association, and the other one is ICD, International Classification of Disorders. These two books, they give the diagnostic criteria. It tells us about the criteria in which if somebody falls or if somebody matches that criteria, we diagnose them as having the depression. So some of the symptoms which are worthlessness or feeling of guilt, impaired concentration, loss of energy and fatigue, thoughts of suicide, loss or increase of appetite or weight. Just, I want to repeat the sentence: loss or increase of appetite or weight. Every time depression will make somebody to, eat less, it doesn't happen. In the atypical depression, actually people start eating more and they gain weight. Insomnia or hypersomnia. আবার ঘুমটা বেশিও হতে পারে কমও হতে পারে. So both is possible. Then the retardation or agitation. Either the person is becoming very much psychomotor retardation is very much there, they don't want to do anything. Most of the time the people are in the bed, they don't want to get up, or they're very agitated. Agitated means the restlessness. Then significant change, if you people see there is a significant change in the weight, significant change in the sleep pattern, there is agitation or retardation, there is a loss of energy or fatigue, the guilt or worthlessness is there, or the person is unable to concentrate or make some decisions, and there is thoughts of death or suicide, then we can say, and the duration is more than 2 weeks. 2 weeks পর্যন্ত that these symptoms are persistent, then we can say the person is having a depression. Then the ICD say, how much bad it is, how much you lost interest in the things. This is the ICD-10 criteria. And then if yes, then do you feel guilty? There is concentration difficulties or not, sleeping problem or not? If the patient has been positive on these aspects, then we say that yes, there is a depression. Depression numbers in depression. Lifetime incidence rate is 33%. It's quite high. Everybody is prone to have depression. And there are other number also. Only 1 in 1,000 is being admitted to hospital. And then at least 1% per surgery will be depressive, after the surgery, any surgery they are talking. These are the different studies or research which I try to go here. Women are very much prone to depression. White women, are more prone to depression. One is our hormone system. We do have some hormonal things which are which give a lot of advantages to us. But yes, the mood is, the depression is, we are more prone to depression. Then for women, we are more emotional in nature. Our brain process information in a way which is more emotional in nature. And as I say, emotional state leads to mood, and depression is the illness of mood. So we are more prone. Then if somebody is having physical illness, then there are more chances that person can have the depression. 50% recurrence rate means that 50% chances that the person will again have the episode of depression. And 12% become chronically depressed. Chronically means they remain in depression. Young people, how it is there in the young people. See, the young people have disturbance in thinking, physical functioning, and social behavior. And suicide among teens is something which is serious concern. And 90% of youngsters show that depression, actually impair their daily functions. Why I put young people, you will be thinking the depression, how it matters if somebody is young or somebody is old. No, the depressive disorder have its, symptoms different in the children and youngsters and the geriatric population. It comes very differently in the different population. And in the studies it has also been found, अब कुछ लोग ये भी बोलेंगे कि बच्चे क्यों डिप्रेस होने लगते हैं. No, we do find children who have, the depression, but the presentation is different. The way they present with the symptoms is entirely different as the as the adult show the symptoms. Infants are also being found who have uh, depressive symptoms. Especially it has been found in the infants who are in the institutional environment, like in orphanage or adoption homes. Then the preschoolers have symptoms which make them more, जो छोटी छोटी बातों में रोना, माँ के साथ ज्यादा चिपकना शुरू कर देना. These are something which comes for the preschoolers. School age children, what make how they come with the symptoms. If you have, your siblings, younger siblings in the family, please be very vigilant, because nowadays I'm getting lot of patients, lot of clients who are in the school age, and the symptoms which are the parents are coming with the symptoms of irritability, increased irritability, then destructive behavior. Earlier the ছেলে খুব শান্ত ছিল, হঠাৎ করে খুব ডিস্ট্রাক্টিভ হয়ে গেছে, ছোট ছোট জিনিস নিতে রেগে যাচ্ছে, ট্যান্ট্রাম থ্রো করছে. These, if it is increasing in frequency, then there are chances that they are missing their friends. They are having their teachers on online school and everything, but still they are the one who are actually being, they are being victimized in whole process. So there are chances that they are also having some kind of depressive symptoms. Preteens, they show the more of self-blame, low self-esteem, persistent sadness, and the social inhibition. Then intellectual and academic functioning. We earlier I talked about, the physical development, the physical functioning, and good physical health, where I talked about the Complan and everything. Mama log bachcho ko roj boost, Complan and bond meter, this is all providing, where Pediasure also is there. But to why, what the main concern is, what, they should be good in their academic functioning. Yeah, this is what every parent want. But what about the mental health? Because we don't know, most of parents don't know that depression or anxiety, these issues can actually hamper the intellectual and academic functioning of the child. Whether the child is the college going child or the school going child, actually the having depressive symptom can hamper the intellectual and academic functioning. If you are having depression, you will be selective attention. Your attention will be very selective. Some stimulus in the environment can take your attention, and you can ignore the other one, which can again affect your academic progress. Then the feeling of worthlessness, negative beliefs, attribution of the failure, self-criticism, and automatic thoughts. Automatic thoughts are, how I describe automatic thought. There is a voice inside all of us. Whenever we are alone there, or we do something, for example, if you are sitting in this, you are hearing to this talk, most the automatic thought can come, and कब ये मैम बोलना बंद करेंगी, कब कितने बजे ये खत्म होगा, कब मैं वापस जा पाऊंगा. This could be an automatic thought. You are not trying to bring this automatic thought inside you. Or automatic thought could be, she talked about the worthlessness, and I was also feeling like that. Or anything, any voice which can come inside you, and where we talk it about ourselves. Okay, so these are the automatic thoughts. How these automatic thoughts come, and every time we do something, these automatic thoughts come, and they, if they are negative in nature, they can hamper our, peace of mind. And in depression, most of time the times of the patients are reporting to having this negative automatic thoughts. Then pessimistic outlook, negative self-esteem, and hopelessness, suicidal ideation. Social and peer problems. When we have the feeling of loneliness, I already told you that social support we need because we are actually the social being. So isolation, loneliness can lead to the depressive thoughts. Family problems can lead to depressive thoughts. Then this is the topic which I have to take because this is something which need attention. Depression in society. Depressive uh, thoughts or depressive mindset can lead to suicide because in depression the suicidal thoughts are very common. The person is cornered, or the person is there in the point where he doesn't find anything good in living or continuing his own life. So this is something they have a very lethal relationship. So, and that is why we should be more vigilant about the depressive thoughts. Then, what we do as mental health professionals, when the people say, "आप लोग counselors और psychologists क्या करते हैं?" हम क्या करते हैं? That is what I wanted to tell you about this thing. We do lot many things. One of thing of what clinical psychology does is to do the assessment. What does that assessment mean? We study, we rate the severity, we study the duration, we see the social network, view how the person is viewing self, the world, and the future. We make the report on the past history. We take the record of the biological features. We do assessment on these lines. Then why we should not be scared to go to some mental health professions? And because वो लोग तो हमारे बारे में सब कुछ जान जाएंगे. देखिए, if you want to have help or anybody seeks help, they have to open up. But I want to assure you, when we are doing the assessment process, there are no directive questions. They are not closed questions. Okay, we don't charge you with something. It is always the therapeutic relationship. We are the professionals. We know how to deal with these issues. We have training with this thing. It is our profession. So we know how to form the therapeutic relationship with the client. So please be assured that proper empathy is there. It is a confidential thing which we follow. And we summarize the thing, which can lead us to the management of the client. And I want to make it very clear that depressive illness is something which is different from the blues. Right? Blues, morning blues, Monday blues, and what not blues. So feeling low, feeling a bit at the lower side of the mood is the blues. But depression is something else. It involves the chemical changes in the brain. There are something, in the language of Munna Bhai MBBS, it's a brain ka locha. There is something which is causing it, this brain ka locha. That is why we need medication and proper therapy for that. For depression, both, sometimes only one or sometimes both drug and non-drug approaches given to the patients. Pills for the symptoms and talking for the problems. There are notion or the myth in the people that they feel that antidepressants are something which is addictive in nature or habit ban jata hai और बहुत सारे side effects होते हैं. तो let me make it very clear today. Modern day medicines, they are very safe. Second thing, and it take, every medicine have some kind of side effect. If you take paracetamol, it also have side effect. It can cause acidity, so every medicine has a side effect. But believe me, antidepressant, when it given to you, the side effect is being taken care of. These are very safe. They don't cause that much of side effects. Moreover, it take time. ऐसा नहीं है कि मैंने आज दवाई खाना शुरू किया कल मेरा मूड एकदम बिंदास हो जाएगा. No, actually medicines take 3 to 4 weeks to get start working, because it takes time to reach them to the brains, to the neurotransmitters. That is why it takes time. to the antidepressant to start working. Sometime I have seen in my practice that people start taking the medicine for 1 or 2 weeks and then they say কিছু হলো না, কিছু লাভই হলো না, এই জন্য আমি বন্ধ করে দিয়েছি, আমার আর বেশি অস্বস্তি লাগছিল। So you have to be patient, you know, you have to show patience with the medicines. It take time. Then I talked about the side effect thing. Talking therapy, जिसको हम बोलते हैं, that is a psychotherapy. Psychotherapy, what it does, you know what? Yes, the brain locha and the neurotransmitter thing is there. But what about the, you know, when I say the vulnerability comes when the person is having some kind of a problem, or the person is facing some kind of issues in life, like stress event he's facing, or he has gone through some loss in his life. So there are some problems in which the therapeutic intervention comes. It has to be, you know, we have to start therapy to make the person solve some problems and to change the, you know, the negative set of the mind towards the positivity. We do it by the psychotherapy, and which is also a very professional thing to do. So we are trained to do that. That is why you need to go to some person who is trained to do the therapy. Then what else we do? We make a person adjusted to the crisis. We identify the negative beliefs and the behaviors in the person, and we try to, you know, replace them by the healthy, more positive ones. We explore the relationship, and then we help the client to develop the positive interactions. We try to make them equipped with the, you know, the coping skills so that they can solve their problems more effectively. And most importantly, we try to identify the issues which are there in the person's life, which is making them prone to the depression. With this, I'm at the end of my presentation. Thank you. And there are a lot many things which I can add, but I didn't want it to, you know, I don't want it to go on and on. So if there are any questions, please ask me. Thank you.
Thank you so much, ma'am, for the lovely session. And there are certain questions on the chat box. I would request the manager, Neha, to please read out the questions to ma'am so that ma'am can answer. Neha?
Okay, so ma'am, questions that we have been asked is, do we inherit way of thinking through the genetic inheritance? In other words, can thought be a genetic phenotype? This question has been asked by so I would request you to answer.
Yes, you know what? Genes everywhere now. Earlier, the biological psychiatry or the genetic, you know, you people are. Samajit is also a student of genetics. You know how genes affect everything. So yes, genes have their say in our behavioral health also and our psychological health also. When we take the record history, when we talk, when patient client come to us and we go for the, you know, we make a record, the patient, and we do the assessment, we have to take account of the positive family or the negative family history. Family history is something whether the client parents had any issue or, you know, any problem psychological in the nature, or whether the first degree relatives had some kind of trait or not. If somebody is having the history, positive family history, it makes them more prone. You know, when the it means that when the stressful situation will come, they will be more prone to develop the depression. So yes, if you do have some kind of positive family history, please very vigilant about yourself. Okay, you need to be very vigilant. ऐसा नहीं है कि every time you will develop the depression, but yes, you are more prone. It make you more prone to develop psychological disorders.
The second question we have from Shayan Karmakar, and the question is, how to control anger and an agile mind?
Anger
and agile mind.
I cannot hear you. Anger, I can understand anger.
Ma'am, how can we control anger and agile mind?
Okay, this is anger is something. Firstly, you have to identify identify that you are having some kind of anger issues. Most the client which I have seen, they come very late to us. It's like always then they will say, "हाँ मुझे আমাকে আগে থেকে লোকজন বলতো আমি একটু তাড়াতাড়ি রেগে যাই কিন্তু আমি এটা বুঝতে পারলাম না এখন বুঝতে পারছি যখন আমি সবকিছু হারিয়ে যাচ্ছি." So first step is you have to acknowledge it that you are having the anger issue. You do raise your voice unnecessary. You become more aggressive in nature when the things could have been tackled in the other way. First thing is acknowledgement. Second thing is finding the ways. You have to identify what are the things which make you angry. Whether somebody poking on you make you angry, or somebody is not giving me proper attention make you angry, or when somebody don't listen to you make you angry. Firstly, analyze it. Then what are the things in the environment which make you angry? Third thing is on the spot kya karna hai. When somebody is saying lot many bad things to you and you are feeling angry, tabhi ke tabhi kya karna. First step is ওখান থেকে চলে যাওয়া মানে নিজেকে সরিয়ে দেওয়া. If there is a situation you think that I know I will get angry or এখনই আমি মারধর করতে পারবো या কিছু জিনিসটা ভেঙে দেব. Most of the people which come to me it's like কি আমরা ভেঙে দিই. টিভিটা ভেঙে দিলাম, মোবাইলটা নতুন কেনা ছিল আমি ভেঙে দিলাম কিন্তু নিজেরটা ভেঙেছি কারো ক্ষতি করিনি. What does it mean? Anger is anger. If you are নিজেরটা ভাঙছো তখনও তো অ্যাঙ্গারই আছে. কি করতে হবে? সবথেকে আগে ওখান থেকে চলে যাও. The situation which can make you mad, okay, or make you aggressive. ওখান থেকে গিয়ে একটা জল খাও, কিছু করো, and then after putting your mind, come back with the valid points. You have to put your points in an assertive nature. You have to say your mind, but in a way in which you are not. Other person cannot tell you তুমি রেগে যাচ্ছ কিন্তু তুমি কিন্তু রেগে যাচ্ছ. Most of the people I found they say this তুমি রেগে যাচ্ছ so that to make you more aggressive. So you have to control it. So these are the small tips, or if the problem is really huge or you think that you need help, so please seek help with a professional person.
Thank you, ma'am. Ma'am, there is another question from Andrea Bhattacharya, and that the question is, ma'am, what is psychomotor retardation?
Psychomotor retardation is something which make you very slow. Sometimes we don't want to মানে ওই যেটা আমি বললাম উঠতে ইচ্ছে করছে না, স্নান করতে ইচ্ছে করছে না, উঠবো মানে everything you are taking more time. Cognitively also you are taking more time, and bodily ways also. The motor means your bodily functions. You are taking more time to do anything. মানে খুব জল তেষ্টা পাচ্ছে কিন্তু উঠতে ইচ্ছে করছে না, এইটা মানে কিছু কাজ করতে গেছি তো অনেকক্ষণ মানে লেগে যাচ্ছে একটা কাজ ফিনিশ করতে. অটোমেটিক্যালি যখন এই জিনিসটা যখন আমাদেরকে স্লো করে দেয় তখন আমরা বলি এটা সাইকোমোটর রিটার্ডেশন. ইট মিনস উই আর নট ওয়ার্কিং as effectively and rapidly or তাড়াতাড়ি যেরকম আমরা আগে কাজ করতাম এখন আমরা করতে পারছি না. কেন কি আমরা এনার্জি পাচ্ছি. For the depression, the most of the people say that they are feeling fatigued, they are not feeling energized enough to do some work quickly.
Thank you, ma'am. Ma'am, there is a question from Mohammed Afidi Fazal, and the question is, ma'am, can you just tell some points about mindfulness and how to get the maximum output from our mind?
See, mindfulness is not a therapy. Mindfulness is something which is lifestyle skill. Lifestyle skill is something if you follow in your life, it will help you deal with lot many things. And mindfulness, it's very much in today's world. Lot many people are saying lot many things about mindfulness, and we see. But it's coming from the Buddhism philosophy, where they say that you have to see everything in the current, in the present, scenario. It means if mindful eating, it means if I'm eating something, I have to see, the color of if I'm eating an apple, then I have to see the color of the apple, concentrate on that, not on any other thing. Then when I put it inside my mouth, how it tastes like, what was the first, when I eat, bite the apple, what was the juicy flavor it was having. Everything I'm doing, it should have the present, right now approach. I'm not thinking about my past. I'm not thinking about my future. but whatever I'm doing it right now and with enjoyment. I'm doing it with the fulfillment. They say mindful eating can help in reducing weight, because most of the time we are gulping the food. We are, this thing is there in our hand. We are connecting with this, people, and we are eating our food and we are gulping it. We're not enjoying our food, which is making us eat more. So we can have that mindful eating. And how I can practice the mindfulness in our daily thought? I can see the thought which are coming in my mind. Thought come as a train. तुम कुछ भी नहीं सोच रहे होंगे तब भी थॉट आएंगे, तुम कुछ चाह नहीं रहे होंगे सोचना तब भी थॉट आएंगे, but to have those thought without getting attached with them is mindfulness. একটা থট আসলো চলে গেল, একটা আসলো চলে গেল, আমিও না থট সঙ্গে যাচ্ছি না। Here I'm controlling my feelings to not get affected by my thoughts. If I can do it, it has to be started with a practice. Usually mindfulness start with some kind of meditation techniques. You have to follow it. Then you can control your mind effectively by that. But it is a lifestyle stage. You have to practice it. Okay. Last question.
There's Radhika Chakraborty, and her question is, how can we gain mental strength and stay at complete peace of mind and not get bothered about any negative comment that our surrounding people may throw at us?
See, there are two questions in this one question. First thing was, how we keep ourselves psychologically healthy, or we can protect ourselves from the negative thoughts. पहले मैं उसके बारे में बोलती हूँ. There are something, in my last, I had a very good session with college in Siliguri. There I talked about the gratitude. Gratitude and depression, they cannot come together. Okay. This is something which is positive psychology. Positive psychology means there is something positive everywhere and we have to try it out. First thing, every time whenever you feel sad about anything, you feel negative about something, remember the last time when you feel good, or what you did which make you feel good, and how you were helpful to others. When the last time you were helpful to others, it can give you lot of positive energy. And how you can do that? Please be show gratitude to the others. Be very positive towards others. Say thank you more often. Say you are looking so pretty. This Neha is looking so pretty today. And it's true. If I give compliments, it means it is something which is positive inside me. If I'm developing something positive, I am giving something positive. And remember, you are not doing it for yourself. You're not doing it for others, but you are doing for your own self. Because if I do compliment to you, I'm actually feeling good. If somebody is running this platform and from his regular classes and everything, and I compliment him, it doesn't help him, it also helps me, because I have the positivity to compliment him. So try to do this thing, try to help the people. If you do this positive thing, believe me, you will full of positive energy, you will full of positive thoughts about yourself. And whenever you feel let down by the people, remember these small acts which you do. Okay, when you feel good about yourself, last time when I helped my mother, I felt very good. So this is a positive thought you are having. जैसे आपको कोई खराब फील करवाता है, thought about that. Okay, for this person I could be bad, but I am good because I'm helping people. I'm doing the good work. So this gives you the positive feeling and the positive confidence. And regarding the second thing, how to deal with the people, dealing with the people is like you cannot nice to everybody. क्या एक थोड़े दिन पहले मैं पढ़ रही थी, you are किसी ना किसी की जिंदगी में आप विलियन हैं, ये आपको एक्सेप्ट करना पड़ेगा. And please stop having this social desirability thing. everybody should like me, everybody should, respect me. This can't be true. It means you are having some kind of, automatic negative thoughts or automatic thoughts which are distorted in nature. You are thinking everybody should praise you, everybody should understand you. It is not possible. Is it logical that everybody in this whole earth, in this whole universe, will gonna understand you? No. Please accept the illogical part of your thoughts, then it will be very easy to deal with the people. It's okay if somebody is not liking my talk. It's okay. Somebody is liking, it's also okay. We should not be ready to judge people ourselves, and we should not judge let other people to judge us. Anything else? Not audible, Neha, not audible.
The last question we have is, in the face of depression, many a times, often thoughts of self-destruction comes, but something inside us doesn't let us do that. In that state, how can we control ourselves?
Mane, you want to do self-destruction, and how to control that positivity not to do it? I couldn't understand the question. Please repeat.
I'm repeating the question. In the phase of depression, many a times, often thoughts of self-destruction comes, but something inside us doesn't let us do that. In that state, how can we control ourselves?
See, मैं आपको एक बात बताती हूँ. Depression is not always, or the self-destructive behavior or the suicide is not always from the depression. You have to understand it. Sometimes it is from the attention-gaining thing. I want attention of other people. That is why I'm doing it. Or sometimes it is some kind of impulse, control. This thought is coming and I'm not able to control it. Impulse is something, impulsivity, that some thought come and I am doing it. So every time depression or depressive thoughts are causing the suicidal behavior, this is not true. But if, because this talk is on depression, and if somebody is having depressive symptoms for 2 weeks, for persistent depressive thoughts for 2 weeks, and then he's also having the suicidal ideation for some time, and he want to seek help. First of all, you have to ask for help. If you are thinking that I might harm myself, please talk to others. And I will make a request to all of you to be very vigilant about your friends, your close and dear ones. If you see there is a behavioral changes in the people, abrupt behavioral changes. Today only, one speaker told us, in the morning we were discussing this only, and we were discussing how the young generation, they don't send, they become inactive on the social media for some time, or they are not responding to your calls, or they are not responding the WhatsApp message. It means there's something wrong with that person. Just send the message that I'm there with you, or are you okay, or how are you, long time no talk. It's something like this, so that the other person can understand. It is not of the person who is feeling the suicidal thought much to do, apart from seeking for help, but it is somewhere we, the people around that person, to make him understand that we are there for him. It doesn't mean that you will make that person understand, अरे तू इतना weak है, तू डिप्रेस, तू सुसाइड करेगा. सुसाइड तो वो लोग करते हैं जो हार जाते हैं. Please don't say this. This is nothing to win in this life. This is nothing to lose in this life. We are not fighting some war here. This is life. Don't make that person even feel more worse. I'm losing. I'm not a good warrior. I'm losing it. If you're saying like this to your friend or anybody who is feeling suicidal, it will increase his problem. So try not to say all this word, but try to be a listener. Try to make him understand that you are there for them. And if you think the problem is, it's grave, then please seek for the professional help. Thank you.
Thank you, ma'am.
Thank you so much, ma'am.
Thank you.
We hope to have you once more. Before we leave you, I have got two announcements. One is on this very platform, on this very occasion, I would like to announce that BioSpectrum is coming up with a quarterly e-magazine that will be available. So I would request to please present the first look of the cover for the October issue. Uh, this magazine is going to have all important details, all important papers that will be that is there, many new facts that are actually very much unknown. So today we disclose the first issue. The link for subscription will be available in the website, and this is a poster view. This is the first look of the e-magazine. The name of the e-magazine is BioGlobe Spectrum. So this magazine will be available. Maybe we are trying around 15th to within 15th or 17th of October. After registration, you're going to get this by email. Firstly, I would like to thank ma'am for giving her precious time. I know she is very busy from the morning. She has been hosting so many events. So thank you so much, ma'am. Hope to have you once more with us. And before we leave you, we have got a token of appreciation for you uh, that will also be mailed to you. So we would like to just display it in front of everyone. So this is just a token of appreciation from the BioSpectrum team, from the complete core team that we have. Uh, Thank you, ma'am, for your time, for your precious knowledge, for your precious views and everything that you have updated with us.
Thank
Now,
you. Thank you a lot. And all the best for your ventures. You know, different ventures you are doing. All the best.
thank you so
Blessings. A
much.
lot of blessings.
Thank you so much, ma'am. I would request the participants to be with us for a few minutes more because we have one more speaker with us as a judge. And then we're just going to follow up quickly with the competition views. So without much delay, I would request Radhika ma'am to please say a few words on mental health and issues. Ma'am, can we have you? Thank you so much, ma'am.
Hi, hello everyone. Good evening.
Good evening, ma'am.
I can just see few faces. I can see one beautiful face of Sayoni and somebody who I can't read the name, and of course Samarjeet.
Thank you,
I'm
ma'am.
thankful for making me a judge here and giving me this platform. For others, I can see a lot of people. Neha specifically. Did you just come to read questions? No. Okay. So I see a lot of people, their names, and believe me, I've done so many sessions, so I love to see all of you. So if that's possible, then that will give me motivation that I'm not speaking to four people. So yes, and I'm Radhika. Giving a brief description is a little bit difficult because we engage ourselves in so many things simultaneously. But definitely, I'll try. So I'm a psychology enthusiast, and I've been trained in clinical hypnotherapy, like Samarjeet said, NLP, neuro-linguistic programming, acupressure, and other integrative therapies. I'm the founder of Socially Sold. So it's a startup with its focus on digital media marketing, IT, and web development services, along with educational technology. I also work with Psychosiksha as a senior executive, and I'm associated with Sampoorna Manosthiti as the founder and the vice president. Sampoorna Manosthiti is a registered NGO dedicated to the cause of mental health and well-being. So yes, see, I told you multiple engagements, and if you wish to know about any of the therapies, so I'm right here, and you can always keep messaging me after this also. So, just a very small speech. I won't bore you, I promise. I'm sure that the past 1 hour there was so much information and so much knowledge. So, it'll be very, very short. So, on this World Mental Health Day, it's a privilege to represent Sampoorna Manosthiti as we bring together our knowledge, our ideas, and thoughts in order to support and spread the importance of mental health in the modern times. If there is one thing that everyone has learned in 2020 is that mental health and its effects are real. So we've been locked in our homes for months, and the fear that takes over us when we think stepping outside is the evidence to the fact that health is not always simply about physical wellness. I hope all of you would know about that. Mental health, including both its wings, wellness and illness, deserve to be given attention. The whole world observes World Mental Health Day on 10th October, and but I feel that we must make sure that this observance and this conversation that we are having today is not just limited to today. That this pledge, we should take, and the post that we share, it shouldn't end up being a mere lip service. So it is imperative that the lessons of empathy, of sensitivity, and of companionship stay with us beyond this day, this month, this year, specifically not 2020. So, yes, the importance of mental health cannot be understated in any terms, whether it's medical, psychological, social, financial, ethical. Poor mental health is a cause as well as an effect of poor self esteem, lack of self confidence, and lower expectations from our own self, from yourself. Naturally, this spills over into our work life, our productivity, our relationships, and every other part of our life. When employees of a company, or for example, people of a nation, are not performing to the best of their abilities, then it is natural that a company as well as its nation will lose out on the monetary gains so that it could have made. So, same way, I feel investing in mental health, even if you're doing very bits by bits, just sleeping on time, or just taking 5 minutes a day to meditate, or just trying to vent out your emotions, talking to somebody who you feel will be a good listener rather than giving advice. So that will definitely lead to a richer, happier, and more satisfied nation in the long term. And it is thus a moral imperative to emphasize the importance of mental health, not just for us, but obviously for our future generations as well. So, yes, it is with this hope that I sit here hoping for a stronger, better, and brighter future. The change, of course, begins with us, begins with all of you beautiful people and handsome boys here. So, yes, that's about me, and I speak very fast. I'm so sorry about that. But that's again, platform is open, and if you have any questions for me, so that's there. And I'm really glad again, Samji, thank you for having me here. So
Thank you so much,
I'm
ma'am.
sure that all of you are here and giving so much importance to mental health.
Thank you so much, ma'am. We'll just request Dr. Nirjhar Dasgupta sir to please give a short speech because sir has to leave. So we just request sir. Sir, you here? Just a second. Okay. I guess sir is left. Sir will be joining just now. Just I would like to tell one more thing that Shivani ma'am, Radhika ma'am, and Nirjhar sir, three of them are our judges for the competition that we have hosted. We are just going to get along quickly with the competition. Before that, we'll just brief you about the certain rules and regulations about the event. We have got more than 20 to 25 entries for this World Mental Health Day. May it be dance videos on World Mental Health Day, that is actually was very unique for us. We have got many write-ups, and seeing on that, previously we have decided that we are going to give out the prizes as a first, second, third, but it would be proper injustice to do that where depending on contents and videos. So what we have decided is we have segregated both the departments like content and videos, and we have increased the price. So we are going to have two prizes, the first and second prize for the video and first and second prize for the contents. The results will be out on Monday by 11 o'clock. because our judges need time to actually scrutinize them, because for me the videos are really great and it is very difficult. I know my judges are going to have a very difficult time to judge them, but still I need to give my judges a bit of time. So I would just request you people, if you have any questions, you can just type in. We have got our mentors, we have got our teachers in, and we're just going to start with the demonstration of this contest within 1 minute. And thank you, Radhika ma'am, for being with us, for accepting our invitation, and making this MINDMENT by BioSpectrum a success. We also have got a small token of appreciation for ma'am as well. So I would request Shupriyo to please display it to everyone. It will be mailed to ma'am personally. Since we cannot meet, so everything has to be done online digitally. So, and we are again.
I definitely hope to meet all of you very soon. So hopefully next time BioSpectrum will not just be a page, but anything that you wish, a magazine or an organization. And then when you do a session or a webinar or a seminar, then I'm sure that I'll be a speaker there or a judge there.
Thank you so much, ma'am. Shupriyo. Just a second. Shupriyo, please display. Yes. So we have got Nirjhar sir here. So I would request sir to please say a few words, as sir is the mentor of BioSpectrum and equally and highly talented. So I would request sir for her words, for his words. Sorry.
Thanks for the nice words, Samarjit. So actually, I have been made the mentor by these guys. This is a bunch of very enthusiastic guys. I mean, by guys I mean guy and girls as well. So they are very enthusiastic and they always come up with new ideas almost every day. And it's really tough for me to keep up with these guys. To be very frank with you guys. So today's topic, as Sampoorna was actually discussing with me a few days back, so actually he came up with this idea. So I think what both of the ma'am said, they are actually the maestro of this subject, and I being of, I mean, I am not from the background, from this background, so I am not a very good person to talk about this, but rather what I would say is, like, always what I would suggest rather is always try to be look at the better picture. That is, all of you have very good memories in life. So all this during this pandemic, all our life have been shattered. Some of us, we are still, like, for us it is just psychological problem. For others, and a vast majority, it's a very huge financial crisis. A lot of people actually are going through very crunch situation right there like this. So what we are facing actually just psychological, that we cannot meet with the friends, we cannot go out, we cannot have a party and all those things. So that's the major issues that we are having. But actually some of the people who are having financial crunch, and so they actually have I mean, looking at that, or rather the problem of those people, ours is, I really don't think ours is that big a problem. That's why I always mention, look at a bigger picture. And always, all of us have very good memories in life with our friends, with our families. And so that's why this mental health, obviously, in this current age, mental health is always a big issue, because all of us are very lonely at one point in our home or in somewhere, because previously what you used to do, you used to be in a family surrounded by your cousins and everything, but nowadays in this nuclear age, we actually only three people are staying in a house in maximum cases, or four. So that's why we always get very less people to share whatever problem we are having, because some of us are not very much familiar. I mean, they are not used to share everything with, and we obviously cannot do that with our parents. So in that, what you can help is you take help from any friend wherever you are going through any bad situation. Like, life always goes through ups and downs, according to me, because everything that is living goes through up and down. Only thing that is stagnant is the dead. So as long as your life, you will have ups and downs, and you, but in the course of life, you have to adjust, start to adjust, and learn to adjust to that. So that's all that I can say right now. And just be cheerful, just be happy, and obviously there would be some ups and downs in life, and just you have to deal with it.
Thank you so much, sir, for your precious words. Uh, I would request Shupriyo to please display both the token of appreciation for Radhika ma'am as well as for sir, and then we straight away go on for the contest. This is what we have for sir. Just a small token of appreciation from Team BioSpectrum. Thank you
Thanks
so
a
much,
lot.
sir, for being with us. And just to mention, this full concept of this webinar, this full concept of MINDMENT is has been supported and has been guided completely by sir. And I'm actually blessed to have sir as the mentor of my page, or rather our page, because it's a team of 40 people working together. Thank you so
Thanks a
much.
lot.
And I have ma'ams. This is for you. Just a small token of appreciation from Team BioSpectrum. Uh, we
Thank you
hope,
so much. Very sweet of you.
thank you. We hope to have you once more. We request you to please be with us while we go on with this competition part. Uh, and we are going to make the drive links and everything available to you. I would request Shupriyo to please present the first video. By the time I would just announce the prizes. All the participants are going to get a participation certificate. The top two from both the categories get a e-certificate. The first prize winners of both the categories get 200 rupees cash from BioSpectrum, and the second prize winners from both the categories get a 100 rupees cash from BioSpectrum that will be directly transferred to their Google Meet, to their Google Pay or their bank accounts, or whatever details we get. So thank you so much. Shupriyo, can we just start with the first video? Yes, first video please. The first video is by Antar Bhattacharya. Uh, it's not audible. It's not audible. Shupriyo, it's not audible. Yes, yes, yes. We're sorry
It
for
is
the.
it is visible actually because you can see it from the person's behavior. The person can't focus, the person can't sleep at night, the person can't concentrate on anything. Mental health is very much real and it should be considered not as a taboo but like any other diseases. Seek professional help when you feel like, and for me, being a sufferer myself, I can tell you that this doesn't go away by itself. You need to seek professional help. I have had schizophrenia I have had bipolar disorder, but I left my treatment halfway because I thought, oh, I will be getting better on my own. But I didn't. It just dragged back many things with it, and now I'm a sufferer of severe anxiety, severe depression, and uh, BPD and PTSD. Sounds funny, right? Our brain is very much complicated. You don't know what's going on in there. So, better be safe than sorry. Depression is real, anxiety is real, everything is real. So, just hoping that it will go away by on its own, just doing what should I say? Having bad coping mechanisms won't help. And yes, if you are feeling very much anxious or very much ferocious, I can give you a tip. Just take deep breath. One, two, three, hold, then exhale. Or like that 5 times. Do it for 15 minutes and you will be feeling much better than you were than before. I learned this from my psychiatrist. So it actually helps. So mental health should be considered as a disease. And I know therapy comes costly, but you should seek it. It helps a lot. There are things which we can't tell to anybody. There are things which just stays in our subconscious minds and they just keep on bothering us. But that needs to go away. That needs to go away for our well-being. Else, else that subconscious mind will bring back weird mental health issues, which will make you very much hopeless, very much, it will make you suicidal. And 381 people kill themselves every day, and 1 lakh 40,000 kill themselves every day according in Seattle mental health. I don't know. So for the occasion of mental health day, I just want to tell you to seek professional help if you are feeling depressed, if you are feeling hopeless or suicidal, or just be safe than sorry. Thank you. Bye bye.
The next we have got a content presentation. Shukriya. Yeah, you have got a content presentation by Fazil Rabbi. So this is just a content, like we cannot we'll just go up, scroll it up as much fast as possible for the contents, because it is going to be completely judged by our guests, by our judges, not this. So for the content section we are just going to go on with just a brush up. Okay, I would request Shupio to just quickly go through all the contents, just one look of the contents, because displaying the contents here will be not appropriate. So we'll just go on with this. All these contents and everything will be available in our Facebook page, in our website, uh, right after the declaration of the results. We'll quickly go on with the video presentations. The next video presentation is a beautiful dance video that we have, beautifully depicted by Shomita Kundu. So I would request Shupriya to please present it. Yeah.
You were the shadow to my light. Did you feel another star? You fade away. Afraid our aim is out of sight. Wanna see you alive. Apart but still together. You were the shadow to my light. Did you feel another star? You fade away. Afraid our aim is out of sight. Wanna see you alive. Apart but still together.
Thank you. Next, we have got a video by Dr. Praveen Josh. He is a consultant psychiatrist from Chennai. He has also participated in this, and he has sent us a video. So we'll quickly go with the video.
I am Dr. Praveen Josh, psychiatrist from Kerala. I would like to tell you about mental health. Mental health is the state of psychological well-being or absence of mental illness. According to WHO, Mental health includes subjective well-being, perceived self-efficacy, autonomy, competence, and self-actualization of one's intellectual and emotional potential. We all have mental health. It is as important as physical health. People could be mentally ill or mentally well. It depends on our genetic makeup and upbringing, our life circumstances, and the various stresses that we face. Aim of mental health is to help people move up the continuum to able to reach their full potential and live satisfying lives. Being mentally healthy means being resilient and able to cope, feeling in control, being confident, feeling good about yourself, managing and expressing your emotions, building and maintaining good relationship. We all experience conditions where we feel stressed, worried, anxious, sad, afraid, or angry. These are all normal emotions. However, when emotions become severe enough, it will affect person's ability to function, and it can worsen over time, and it can cause mental health problems. There are many different types of mental disorders like depression, anxiety, OCD, psychosis, substance use disorders, etc. When left untreated, mental disorders can be chronic or long-standing, resulting in increased disability and can affect daily functioning, interfering family and social relationships. There are effective treatment and evidence-based interventions available. However, only very few people with mental disorders are sustaining treatment from mental health professionals. This may be due to stigma for seeking help, lack of understanding of mental illness, uncertainty of how to get help, or fear of disclosing mental health problems to others. Of this, stigma remains one of the biggest factors from preventing people from seeking help for mental health problems and getting appropriate support for their needs. It is important to acknowledge that all have mental health and have personal responsibility of how we can improve and maintain our well-being in order to lead meaningful and satisfying lives. So if any of my friends watching this video has got any mental health problems, kindly seek help from any mental health professionals. Thank you everyone for watching this video. Have a nice day.
The next video that we have, the next participation is by Manjurima Ganguly. Yeah.
Hello everyone, this is Radhika Ganguly. Today our topic of discussion is mental health. Every year World Mental Health Day is celebrated on 10th of October. The theme for previous year 2019 was suicide prevention, and the year before that 2018 it was young people and mental health. Before starting right away, I would like to thank Team BioSpectrum for this event MINDMENT, because it is high time with the raging mental health issues. This problem should actually come in the focal point of the society, and it should not what's psychological well-being is that state of someone where someone is functioning at a satisfactory level of emotional and behavioral adjustment. Stating that what exactly is mental health issues or problems? They are basically a wide range of disorders that can affect someone's mood, someone's daily lifestyle, eating habits, and so on. It can include clinical depression. It can include anxiety disorder, bipolar disorders, schizophrenia, addictive behaviors, and so on. It has a wide range. Now, what can be the causes of such problems? The cause can be genetic, or the cause can be certain biological problems like chemical imbalances in brain. It can be certain traumatic brain injury. Other from that, if a mother is exposed to certain toxic chemicals or viruses while pregnant, it can affect the child's mental health as well. Apart from that, history of abuse, trauma, especially in childhood, certain wrong decisions in life can also affect someone's mental health really bad. It is estimated that at least 10% of the world's population is affected of mental health disorders, and at least 20% of children and adolescents suffer from this issue. Mm, two most important thing as citizens we should keep in mind is upgrading our moral fiber. Number one, it is 2020 now, but still humans are facing constant trauma, constant taunts and bullying regarding their economic conditions of family, regarding their skin color, regarding gender, of course, and whatnot, their lifestyle, sexuality, literally everything. Everyone wants the other person's life to be an open book so that they can judge. Um, Basically, everyone has their own battle in life, and we do not know about it. So, judging someone just for fun or just because we want to and we can, either virtually or face to face, based on our narrow mindset and assumptions, is very, very problematic. It's high time the world needs to live and let live. The second very important thing is awareness. Understanding that mental health issue needs medical help like any other disease, like it can be diabetes, thyroid. Just by saying it's a phase, it is temporary, it is just your mood, it will be completely alright, you're overreacting, it does not work that way. Basically, proper counseling, medication, a little bit of support from the surrounding is very, very important in curing certain mental health issues. Let's try being a better human being ourselves. Let's smile a bit more at these strangers. Let's just say something supportive to our close ones who are actually suffering, even if someone is not suffering. Let's support and hold our hands together instead of just laughing at them. Let us give them a safe place so that they can talk about, they can open up about the things that is actually bothering them. And if it is not possible for us to support someone and push them upwards, let's just not pull them downwards. It is very important that we spread kindness like confetti. And if we do that, if we actually help people just by being kind to them, just by saying a word or two, just by telling them that it is all right to feel low, it is all right to seek for help, I think we will overcome this issue. Thank you so much.
Thank you so much. The next video that we have is by Ramandeep Kaur. Yes, the next video we have is by Ramandeep Kaur. We have got two more videos. Just we'll complete these two videos and then we are going to share
myself, Ramandeep Kaur.
feedback.
In this
Just
world
bear with
mental
us.
health, share my point of view regarding mental. Let's talk about mental health in simple words. We all have mental health. It's just as important as physical health. It is not only about mental illness or mental disorder. This is just one part of a bigger picture. It is best to think about mental health as being on a continuum rather than people being mentally ill or mentally well. We all are on continuum and we move up and down according to the factors such as genetic makeup of upbringing or of our life circumstances and the stress we are under. One end to continuum we have mental disorders like depression, anxiety, and the other end we have states of positive mental when we are thriving the contempt of fulfillment. The aim of mental health intervention is to move up to the continuum so that we are able to reach fully potential and life satisfying. And the natural disasters of these responses are feeling sad, stressed, sometimes sometimes anxious, scared, anger, and the list goes on. When you are facing a disaster, we should do pause and reflect. Accept your emotions. It's okay not to be okay. Try to understand your environment. Let help for expert. Keep connected with loved ones. Also consider the positive aspects and the life tools which help us to heal are yoga and meditation, regular exercise, developing healthy diet, listening to music, dancing, and whatever you like, sports activity, writing habits of expressing thoughts. Recovery is not one and done. It's a lifelong journey. Thank you, everyone.
Well, the second last video that we have is by Mohammad Faisal Afridi.
According to the WHO, the definition of mental health is a state of well-being in which every individual realizes his or her own potential, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. World Mental Health Day 2K20 comes at a time when our daily lives have been challenged by the COVID-19 pandemic. Let's talk. We all have mental health, and we should make it a priority to invest a little bit of time in ourselves. Emotions are normal. We all feel happy, sad, angry, depressed. We all have positive and negative emotions that come and go based on what is happening around us. So, good mental health also means to experience negative emotions. It's not always about being happy, it's a part of our normal daily lives. You just need to ask for help. It's that simple. Talking about mental health could and should be as normal as talking about physical health. If we are physically unwell, we let people know. We ask for help. This should be the same for mental health. Do the things you like to do. You can try things like reading, writing, cooking, painting, yoga, meditation, playing sports, and playing with your pet. Just do whatever you feel good and what makes you feel good. And just enjoy the moment. Like I do by watching WWE, playing badminton, making a cup of chai for myself. Thank you.
And the last video we have by Masooda Sultana.
Hello everyone, I'm Masuda Sultana and on the occasion of World Mental Health Day, I have presented this PPT video. So coming on to my first slide, it represents about what is World Mental Health Day. This slide is giving you a brief idea about what is World Mental Health Day. It is a day celebrated each year on 10th of October. So it is an international day which was first celebrated in 1992 on 10th of October. This day is basically celebrated for the people who are suffering due to anxiety or depression, so that many programs could be held in order to help the people to overcome the problems. This day was started as an annual activity of World Federation for Mental Health by Deputy Secretary General Richard Hunter. So it is a brief idea. Now coming to my second slide, here are some mental issues: anxiety disorder, mood disorder, schizophrenia, psychotic disorder, dementia, eating disorder. So here are some common disorders from which people used to suffer. Now coming into my third slide, here are the effect of mental health when you have proper versus when you have improper mental health. So when you have proper mental health, your mind and heart is healthy, your mood is improved, your self-esteem increase, your depression risks are reduced, and your thoughts are very clear. But when you have improper mental, your mind and heart is unhealthy, your mood fluctuates, self-esteem decrease, the risks of depression, the thoughts are unclean, and weird thoughts used to come into your mind. The which are giving us problems or giving us tensions, because usually depression and anxiety leads to an improper body, and it also disbalance your healthy routine. Now, coming into my next slide, these are some risk factors of mental health. Certain factors may increase your risk of developing mental illness. A history of mental illness in a blood relative such as parent or sibling, stressful life situations such as financial problem or loved one's death or divorce, and ongoing medical conditions such as diabetes, traumatic experience such as military combat or assaults, use of alcohol or recreational drugs, previous mental illness. So these are some brief not instructions, actually these are some brief explanation about why the mental illness comes. Now coming on to my next topic, important facts about India. These are actually shocking facts. So out of every 5 Indians are suffering from mental disorder. 50% of corporate India is suffering due to mental stress. A WHO report suggests that India is the most depressed country in the world. The same report states that India is the largest cause of death in the world of age 15 to 35. The average age of 300 people dies every day, 200 men and 100 women. So it is an average report which say that India is the leading country in which the people used to die. Now these are the surprising fact on my next slide. These are interesting facts. Maladaptives. Actually, maladaptive is a disorder in which the people used to escape the reality and they used to daydream so that they won't have to face the people around them. And the second is Capgras syndrome. In this, the people used to feel that their beloved ones are replaced by some imposter. The next is Alessandro syndrome. In this, the people used to feel that maybe their hands are not working by their own will, they are working by someone else's will. So in alien hand syndrome, the people have a different kind of sensation. Actually, this is a abnormal sensation in which they used to feel that the hand has its own will. The fourth one is Alice in Wonderland syndrome. Actually, we all have seen the movie Alice in Wonderland, which is based on unreal things. So in this syndrome, people used to think that the objects around them or the people around them are of different shapes and they are of different types. So this is a very rare syndrome. Actually, all the syndrome which I have mentioned are very rare. So people of the age 10 usually affect due to this syndrome. So here where my PPT ends, and thank you so much for watching.
Thank you. So here we come to the end. In the end, I would like to congratulate and thanks to the complete team of BioSpectrum, because there have been many sleepless nights that we have actually worked to make this a success. It has been actually organized in a very short time, but our team has actually made this possible. Coming to Neha as the manager, the managing coordinator and the poster head Ankita. You have got the blogging head as Shivani. You have got the PR head and analyst as Shupriyo, the conveyor and coordinator as Shubhadeep. We also have got a BioSpectrum junior page that only deals with certain facts. Those are actually attractive to juniors. So we have got the heads over there as Pritam and Arpon. Thank you to my team. We have got a great evening today. Thank you so much. The feedback form is there. Please fill it up. Within 2 days, you can expect your certificates mailed to you. You can now speak if you want to. You can share your thoughts about this webinar. You can turn on your microphones and share your thoughts. Thank you so much. And feel free to connect with us. Feel free to visit our website. Feel free to connect with us anytime. We would love to have you. And also, please, I would request Supriyo to please paste the link of the page. Please do visit our Facebook page for more informations and updates. Thank you so much. Now you people can speak. Thank you. And thank you for making MINDMENT a success. Thanks to all.
Thank you, all of you.
And also, you're going to have this full session, and you're going to have this full session in YouTube. By today, you're going to get the YouTube links as well. So you're going to have this full session in YouTube as well. So you can see it afterwards. Thank you so much. I would request some of you to please say about your experience during this webinar, because this is the first time something like this has been done by BioSpectrum. So please feel free to share.
Turn on your audios and feel free to share.
And we also thank Sampoorna Manosthiti and PraayaS for collaborating with us, and we also thank Atverts Productions for their complete support, guidance, and technical support for making this a success. Thank you all. I will request my team to please say anything if they want to.
Thank you, Team BioSpectrum, for having us on board.
Thank you so much, Siddhant, for making this possible, for going live with the Facebook, and making this. We know we have got a lot of technical glitches, but that's a part. We can't avoid that.
Yeah, apart from all this,
Shukriya, coach.
apart from all this, it's good.
Please share your views, anyone, if you want to.
Speak up.
We don't have any guests here, so you can speak now.
Gotcha.